Robots, the way we know them, are devices capable of independent activities. They work in car assembly lines, aircraft assembly lines. But in surgery, they are instruments that a surgeon will use to make the surgical procedure much more precise. The real name for it is master-slave manipulator. In other words, the surgeon sits on a master station, and then we have the slave beside the patient, which is the arms. Robotics is one of many tools that we use in keyhole surgery. Keyhole surgery had a huge advantages from a patient's perspective, reducing the physical and psychological trauma of surgery. So physical meaning a big cut. So the ability to wake up with 4 or 5 tiny cuts the size of your little finger is a huge advantage. So what robotics does, it facilitates more complex operations like cancer to be done the keyhole way, where in the past keyhole surgery was more confined to non-cancer surgery.
One way to improve the outcomes of the patient is to use keyhole techniques, but that is technically extremely challenging for surgeons because of the difficulty with only having 2-dimensional view, losing 3-dimensional view, and also you have to use counterintuitive movements when you're using laparoscopic instruments into the abdomen. So one way that we've been assisted is using the robotic platform. So robotics brings back to you 3-dimensional vision and typically allows you to make the same movements as you would do as open surgery, and those are translated into keyhole movements. The area of research we're using a lot here at Imperial is enhanced robotic operating environments, and a strong part of that is an image enhanced operating. And what that means is we use imaging like CT, MRI and ultrasound to try and overlay onto the view we have in the robotic console. So the image enhanced operating environment is something that is progressing very rapidly. We now have voice control, so the surgeon will be sitting in the console and using number control by saying 1, 2, 3, 4, we can bring up image enhanced views over the robotic console view for particular stages, such as you can say 1 and that would bring up the renal vessels and highlight exactly where they are. You can say 2 and that would then show you where the renal tumour is. It's in there to enhance the safety of the surgery and particularly thinking about excising the tumour completely, not leaving what we call a positive margin, i.e. a bit of cancer behind that may need you to go back at a later stage and take out the whole kidney. So the end result of this research, apart from assisting the surgeon of course, is making sure that the patient has a better outcome, both in terms of cancer cure, but also in terms of safety and enhanced recovery from the surgery.
If you go and tell a patient that I'm delighted to tell you that tomorrow there's a robot that's going to operate on you, they'll run away and I will be the first to follow them really. I think it's quite important to say it's not really robotics. These are instruments, devices, which are there to help the surgeon to do a better cancer operation, not just to cure you of cancer, but at the same time to improve the quality of life after cancer surgery.